challenge actually see it's hot.
And that's what we're giving you. It's wonderful. If you take light, no, we're not live.
So you want to raise this one? No, just on the back.
Yeah, not good sugar.
No. It's not. It's good.
No water. It's really. You don't need no water. That's right.
What's okay? With options?
Yes. Yes. Easy. Okay. And after complying, well, we can be friends.
So that means we have improved.
You have improved.
Yes. So that walking there.
No, this is only.
You said in case. I said in that in case. Why not do something in case when the water is driving to some water?
The boss of all. Just a straight line.
The only thing that will stop you look at where Air Force Base is here. Look at them go and pass from here.
For the emergency.
The glass is not transparent. It's mirror glass.
You can see.
Yes.
This is VIP. Yeah, but this is actually not a bedroom. It's chemotherapy.
Chemotherapy.
Yes.
For the, before we commission.
Sure. 100%.
I'm not going to see all this.
No, of course.
Opening the chair.
As they are cleaned up,
I know.
we bring back. Yes.
And the labeling of
Like it is.
the doors
Like
and
it
the
should
room.
be. Yes.
Everything else.
Everything. Labels.
Yeah.
Whose are those exactly?
It's VIP rooms.
Okay.
Which one was this way? Yes. Wow.
Very nice.
For chemo.
Everything. Lab. This is general lab?
No.
This is something.
That's right.
Yes.
I understand.
Yeah,
This one should measure by Tesla. 1.5.
Nice. Oh boy. Don't stop. Don't cross.
This is different from Government House.
I'm telling you.
This is latest.
Yes.
This is latest. This is different from Government House.
What's the capacity of this one? How many Tesla?
100 and...
This is the latest.
No, it's not up to 100.
It is. How you know?
This is the latest. Chico, please, you're just for procurement.
No, you are right. You're right.
Tesla. 3
How many
points.
Tesla? Everything comes from manufacturer directly. I was told everything is from manufacturing directly. So special products.
This is the latest technology.
Yes. Yes. I think it's one generation after the government house. I'll be done by tomorrow.
This is the latest technology. Yeah. All right.
Paper, yeah.
This is the Chico I know. The Chico before was somebody else.
I really feel this.
Building the management system. So everything will be modularized. Yes. Remaining and then we close the door.
You are heaven.
Oh, yeah, this is so when you're up there.
Yeah, you are looking.
Just to give the peace.
Yeah, it gives you peace, you know.
Relax.
Wow.
The third project is just probably the single biggest project embarked upon by your administration. How does it feel knowing that it's finally coming to fruition?
Well, for me, it's amazing. I'm so happy with this project. No right thinking person that will come here and that will not be happy. Except you are just naturally an unhappy person. It's amazing. And a project we said within 1 year, and Beggar has completed it. All we're waiting is to take a date for commissioning and just the finishing touches. This is a world-class standard anywhere. The cancer, Cardiovascular, Diagnostic and Treatment Center is world class. I don't know, I'm not comparing, but I don't know any cancer, Cardiovascular and Diagnostic Center that can match this. This is world class. If you have traveled all over the world, you will know what it is. I pray that God is infinite mercy will share our life to invite the world to come and witness the commissioning of this fantastic edifice. These are the things that attract enemies for us. When they see what you have done, not just doing it within the specific time. This thing was flagged off last year, sometimes June, and now we're in September, and they have completed it. Where have you ever seen in this country a project of this nature? Specialist center that will take care of cancer, the heart, and to diagnose and even treatment. To be completed within 12 months, 13 months. And for Jonas Berger of a company of this nature, of this type, to have completed it without any argument of payment, you should know that for us, it's promise fulfilled, promise delivered, like in all of that projects that we have been doing. This September, we are praying that if by the time we finish logistics by this October, and the 8th and the 9th flyovers and the Ahuda dualization will all be commissioned. It's to the glory of God. It makes me happy that I did not just, when you want to start off a gigantic project of this nature, most people will say, forget it. This project will last for 5 years, 7 years, then variations upon variations. But this project will never added any variation. The only additional job we added, which was not part of the initial project, was the radiotherapy center, which also has been completed. And it's better for the world to come and see, like it will be a tourist center. Look at the helipad, have been completed. Look at the doctor's quarters, have been completed. Look at the landscaping. I mean, it's amazing. It's amazing.
When you talk about tourist centers, I want to actually lump two questions into one. What was your vision behind this project? And does it also go a long way? You talked about making River State the hub of medical tourism.
Yes, I've always said so. Each time you look around, most people have died, particularly because of one type of cancer or the other, one type of heart disease or the other thing. And so many people may not have the money to travel overseas. And so we say, look, we can't continue to allow these people dying because of these facilities not available. Now we have provided these facilities, it will cut short of so many people going overseas. It is not because we don't have experts here, but the facilities are not here. And even when you find one, it is not up to standard. So with what we have seen here, and all these things are coming from GE, so it's not as if why it's even delayed up to 13, 14 months. These equipments, you don't buy them from the shelves. They are just, as you order, they manufacture and sent to you. So it will cut short of most of their expenses in terms of dollar flights that we pay outside, and most of that foreign exchange will now remain in this part of our country. So it is amazing, like I said, there's no right thinking person, because you have relations, you have friends who die from one form of cancer to the other, who die from one form of heart issue to the other, dialysis, all these things will be taken care of in this place. And what we tend to do, we're already having discussions with some partners overseas who will come and run this. We're not going to allow it as usual, the ministry, but there are doctors who will also be part of it. But we'll do it in such a way that it will be public-private partnership.